Well, on today's Net Check, now to the southern city of Shenzhen, where controversy has erupted over the fates of about 100 construction workers there. The migrant workers are suffering from a variety of lung diseases, but can't receive paid for medical treatment because they didn't sign labor contracts with their employer. Without those contracts, the workers cannot obtain a formal diagnosis from a government-approved hospital. That means no compensation. One of the workers died from a chronic lung disease last month. He was one of many workers who can't afford to pay for treatment.
Well, the workers are believed to have fallen ill after spending a decade digging holes underground in that city for as little as $14 a day. They didn't ask their employer to sign a labor contract because they were afraid of losing their jobs. BON's Helen Hu has been following online comments in the newsroom and joins us now. Helen, how upset are people online about this story and these workers?
Well, most net users are very angry with the company that employed them because the company knew the working environment for these migrant workers was very harsh and still didn't sign contracts with them. Others say the city's Labor and Social Security Bureau is to blame for not enforcing a contract law. They say the Bureau must find out how the situation was allowed to happen and solve it. After that, they say the Bureau must help the workers to get compensation. Others say it is important that migrant workers know about labor contracts. If all of them had understood this beforehand, the situation could have been avoided.
And Helen, we heard earlier this year of a case involving a migrant worker in Henan province who cut open his own chest to prove he had a work-related lung disease. Is anyone linking these two cases?
Yes, many commentators say the Henan case caused major concern at the time and are disappointed the government and companies haven't learned anything from it. In that case, the government-designated hospitals refused to diagnose the worker before he didn't have a contract. People say workers shouldn't have to be driven to opening their chests to gain their rights. Others are asking why the government didn't do anything when the migrant workers couldn't get their contracts from the company. They say there is an obvious failure in the system.
BON's Helen Hu joining us from the newsroom. There is a formal medical term for this condition. It's called pneumoconiosis. It refers to any chronic lung disease that is started with the inhalation of particles like asbestos or coal, which so many migrant workers are obviously subjected to here. Nearly 640,000 people in China have this condition, 10,000 new cases diagnosed each year.
Right. In fact, the country's 250 million migrant workers are the most vulnerable people to these diseases. So if they don't get proper treatment, it'll certainly going to cause a much bigger healthcare problem in the future.